Welcome back to Upfront. Madison and Dane County have a new plan for curbing violence in their community. The city and county introduced a comprehensive 5-year plan they are calling the Violence Prevention Roadmap. They're taking a public health approach coordinated with community partners and based on data. We're joined now by Madison Mayor Sadia Rhodes Conway and Ariel Smith of Public Health Madison and Dane County, who are overseeing the program. Thank you both for being here on the program. Mayor, let me begin with you. Can you help put into context for us the types of violence and the amount you're seeing in your city?
Sure. And let me start by thanking you for inviting this conversation. I'm really proud of the work that public health has done here. And I think it's really important that we take a public health approach to violence prevention. I think one of the key things about this plan is, we have seen in cities all across the country that the violence and certain types of crime are on an uptick. Certainly gun violence is probably the most concerning for all of us. But also we've seen car thefts and the like. What's important about this plan is that while it will address those issues, it also goes much deeper. And that's because it takes a public health approach, right? So we are going to be looking at intimate partner violence. We're going to be looking at violence that children are exposed to or experience themselves. Because we know that these things are all connected.
Ariel, this is different in and of the sense that violence prevention and public health are in the same sentence. How does a public health approach, and how do you hope a public health approach will reduce violence?
Sure. So as the mayor mentioned, a public health approach to addressing violence allows us to take a data-informed approach to not only give us a comprehensive view of what we're seeing, but also inform and drive our decision-making moving forward. And so with that, we're able to take in both rates of crime and violence that we're seeing, and also incorporate the experience of what our residents are feeling and facing with violence, and use that to inform what strategies and approaches we use moving forward. And that's really the backbone of taking a public health approach to this.
Are there other models you're basing this off, or other cities where this has been successful already?
Yeah, so with Madison, we have a very unique pattern of violence here. And so we worked with partners from across the country. We have partners in Philadelphia who were able to help us and give us some examples of what they've been experiencing and what they've been trying, as well as Baltimore, Chicago, and also some cities that are similar to Madison. And what we were able to do is take some of those experiences that those cities have had and overlay that with what we are seeing here in Madison, coupled with some of the resources that we know that we have here to try to take that comprehensive approach.
Mayor, as I was reading through this plan and the objectives, there was little or no mention of policing or law enforcement. So I'm curious your thoughts on, is this any attempt to remove policing from a response to violence prevention?
No, I think it's an acknowledgement that what we've been doing for decades is not working, right? And so to only rely on a policing approach is just insufficient. The police response to violent crime is not going anywhere, right? That's a key function of police departments. I mean, I believe across the country, but certainly here in Madison. And in fact, our new police chief has been working very hard to look at ways that they can contribute to reducing gun violence and thefts, particularly car thefts. And that work needs to continue. I think this plan is a recognition that that policing work is insufficient to really get at what are the root causes of violence and crime, and start to work upstream to prevent violence and to break the cycle of violence. Particularly, one of the tools that Madison has been using for a couple of years now is an intervention when we do see gun violence in our community. We have an immediate intervention moment to try and prevent an escalation or a cycle of that violence. And so that's I think a perfect example of how the police response and the public health response go hand in hand and have to work together.
I'm curious your thoughts on the pandemic, the impact that has had on the violence you've talked about, and the money the city's now expected to receive from the stimulus package, about $49 million. Can you anticipate using some of those funds to go to this program?
I think that's a big question mark, because those stimulus funds in the Rescue Act, for which, let me say, I am very grateful for, that is one-time money. right? And so we can't use those funds for ongoing programs or for staff, because then we'll be left in the lurch when the money runs out. So we really need to be careful in how we use the Rescue Act money and make sure that we are using one-time money for one-time costs. But certainly we're looking at a whole host of priorities. But to get to your original question, I think there's no question that the pandemic has had an impact of increasing violence in our communities. And we can just look at intimate partner violence alone. We know that with everybody, supposedly safer at home, that is not true for everyone, and that we have seen a rise in intimate partner violence over the course of the pandemic. And that's very concerning for our communities. So yes, I think that that's been a big impact, and it's one of our challenges coming out of the pandemic is to try and reduce those levels of violence.
Arielle Smith and Madison Mayor Sadia Rhodes Conway, thank you both for your time and your perspective on this issue.
Thank you.
Thank you.
Coming up, all eyes on Wisconsin for a Senate race more than a year and a half away.